My mother's alcoholism and depression had always been a part of our family life, and as she got older, it got worse and worse. Eventually, she was beyond any help we could give her. When she was evicted from her senior housing, she had nowhere else to go.
Hi, I'm Will McGrath, and I'm the Outreach Case Manager at the Delana Center. This is where I met Jane. She was eating breakfast here at St. Andrews. The breakfast program is a long-standing community effort to provide a morning meal to Ann Arbor's hungry, and I drop by here once a week to reach out to those who aren't connected with our services. When I met Jane, she was truly down and out. She had run out of resources, become disconnected from her family, and at age 73 was very vulnerable to the dangers of being homeless. At breakfast, I encouraged her to come to the Delana Center where she could get showers and launder her clothes. She also began treatment for her alcoholism and depression.
Really with no one caring about her or her situation or her future, and that's where the Shelter Association was in a position to step in and start helping her almost from day one. We were also able to assign her a caseworker and put her in a position to begin to access the variety of the services that are available here at the Delana Center.
I'm an evaluator, a coordinator, a networker, a motivator, an advocate. I'm Lisa Zucker, and I'm a case manager at the Delana Center. The Personal Action Plan is the keystone of our program, and Jane and I worked together on hers. We looked at her alcoholism, her mental and physical health, and family estrangement.
The Delana Center was her home when she had no home. It was a safe place where she could begin the process of rebuilding her life. Here she could also get the mental and physical health care she needed after a life of addiction.
You have a health clinic here, and you have the health care services and diagnostic capability here that if there is a medical problem amongst any of the clients that we serve, that problem gets addressed here at the shelter, whereas oftentimes without a shelter to go to, those individuals wind up in the emergency room, which as we all know is the most expensive form of health care possible.
We see about 1,100 people a year for health care services at our clinic. On-site treatment is available to our clients through our active partnerships with many other service providers. We have a solid core of medical professionals from our local universities and schools who volunteer here at the clinic, and we could not possibly deliver this care without them. We have over 130 hours a week of volunteer services that go into providing our 6 weekly clinics. We want them to be able to deal with their healthcare crises that are in the way of them successfully getting out of the cycle of being homeless so they can care for themselves.
My mother gained control of her alcoholism and depression, and with the help of a social worker, we were able to start rebuilding our family connection. We watched as she took her last step to get her own place. The Income Savings and Housing Program really works.
The ISH program allowed her to gain an income, save money. She was really happy to learn how to budget in a way that she never had, and then also find housing.
Every single Monday, I go on to the internet, I look under different resources, and I comprise an affordable housing list. I have connections with the landlords in Ann Arbor and landlords in Ypsilanti, so I keep in touch with them. It may be more efficient to work with a private landlord to getting them help in housing versus using the housing list and finding housing on their own. The success story of Jane shows that the ISH program is a positive program, and if every client comes in and works that way, that they could have a success story too.
Jane was able to use our residential program to get her life back on track. Some of our clients are not able or ready to do that yet. For those folks, we provide shelter in the cold weather, along with basic need services such as showers and laundry in order to assist and engage with them until they're ready to end their homelessness. And then they can move into our residential program. It will be ready for them when they're ready.
The beauty of the shelter is the efficiency of bringing professionals here and just the myriad of services that are available through federal, state, and local programs.
We work with their core competency instead of trying to duplicate it. What we are about is ending homelessness, and we connect people to the supportive services, give them the encouragement and the guidance that they need in order to end their homelessness so that staying in a shelter is not a necessity. We were able to come together as a community to build this building. Everyone comes here and works here directly with our clients, and it shows what a community can do when we all work together, public, private, and nonprofit organizations.
The best part of my mother's recovery was that we became a family again.
There's always been a really wonderful mix of staff here, so it's a great place to be, and it's very rewarding.
Out of all the jobs that I've had, I'm not that old, but I love this one the most.
I get to see the community, the staff, the volunteers, and everyone coming together to help people who are really in need of help, and it's really great to see that.
It's an easy place to get committed to fall in love with to a certain extent, because it really does so much good for the client base that we serve.
It's a place of transformation. Every day I come into work and I see people do amazing things.
Seeing people take use of the resources that are there and really turn their lives around is an exciting thing. And it's really great to see people engage in society again.